Jay Pendleton, MedTech Voice. I'm here with Dr. Juan Uribe. Thank you so much for joining us for 5 good minutes with Dr. Juan Uribe. Welcome.
Thank you, Jay, for having me.
Juan is a neurosurgeon at Barrow Neurological Institute in Phoenix, Arizona. He's the chief of spine for the Volker Sontag Chair of Research, vice chair of BNI, and the chair of spine at AANS Joint Sections. Thank you so much for sitting with us, and welcome to the show. It's been a fun journey to see your practice, in Arizona with BNI, and one thing I did want to ask you specifically in terms of patients, how important is patient access to you? Do you get involved, or do you have thoughts about how your patients find you, or do they just find you?
I can tell you my own practice is, believe it or not, most of my patients are actually out of state and word of mouth, It's not I would say it's not the most common way to do it. The most, I would say, common way is you reach out pain managements and primary care physicians, and you have dinners with them, and you arrange a pattern. But in Arizona, just in Phoenix, there is 150 spine surgeons. So it's basically, it's almost I would say a spine surgeon every corner.
Saturated.
It's saturated.
How does that feel? You've built something. I mean, you built it in Tampa. You built it again in Arizona. How does that feel?
It feels great. To be honest, I like when you feel that you can have impacts on people's life, and when people look for you because the quality of your craftsmanship.
That's right.
And at least this is the reward for us. You know how it is. Spine surgery is a very hard field. We're taking a lot of liability just because of the profession, the complications that we can face, and the expectations on the spine are huge. Patients come are like, I was marathon runner, I was playing golf, I was hiking, 3 hours a day. I want to go back to do that. So the expectations are so big, and that's what makes it challenging.
Iterative change and new technology and the advancements. I wanted to ask, as it relates to what's exciting to you next, and you mentioned this in Cabo. Your Cabo talk was brilliant, to what's next, what you're excited about. Anything you'd like to share here relative to what gets you excited about future spine?
Yeah, there is no doubt that the enabling technologies is like what is basically facilitating all the surgical procedures that we have, TLIF is just not anymore. You do a minimal invasive, you put a retractor and you force a cage into the space. Now is how can you access the level without damaging the end plates too much? How can you be more precise? How your incision can be smaller? So all these procedures, one by one, the enabled technologies has been facilitating them, and that's the big penetration right now. Like everything in our life, AI is gonna affect our field as it's affecting clothes, cars, TV, you name it. Everything is there. They're everywhere, and that's coming.
Is there a double-edged sword to relying on enabling technologies?
We saw it on the brain surgery, the way that the neurosurgeons were trained to do brain surgery 30 years ago is that you were using landmarks, like 2 fingers spread above the ear, and then you say this is what the lesion should be. Nowadays, you have navigation, and the navigation puts you right there. So right now, if you have, let's say, a simple tumor lesion on the brain and the navigation system is down, I bet that 90+% of the neurosurgeons, they will cancel the surgery. That's a new era, and that's going to happen probably in the spine very soon. There will be at some point that if you don't have navigation, you won't do your case. You don't have good monitoring, you will not do your case.
Yeah.
Because at the end, you don't want to compromise the outcome.
This industry is so full of these amazing people, and you're one of the leaders.
It's a big family.
I thank you enough.
Thank you, Jay. You're
Yeah,
the best,
brother.
my friend.
Hey, it's fun.